Hello, I'm Dr. Swati Mallick and I would like to welcome you all to today's webinar. Today we'll be dealing with moving on with TrioClear clear aligners. All the situations that we have when we have issued the aligners to the patient, the different complications and the troubleshooting of different issues will be dealt with today. I hope you enjoy this session, and from here, let's start. So first of all, the most important thing that we need to focus is on the checkup appointments. It's very important to focus on two major things: the frequency and the different checklists that we need to observe during the appointments. Now, the frequency for appointments ideally should be followed within 4th to 6th aligner, because by the 4th aligner, there are chances of misfit. Of course, there are multiple factors which determine this. Number one, the patient's compliance. Number two, the dentist experience, and most importantly, the movements that are required for that particular case, as well as the complexity of the treatment. It is good for the doctor to use the app so that they can track it better. And if there are any changes, it is faster to be checked upon and can be treated sooner. So there are checklists. It basically includes 6 different factors. We include patient compliance, oral hygiene, tooth tracking and fitting of the aligners, interproximal contacts and attachments, action required for the appointment, and appointment conclusion. Let's go with the patient compliance first. So how do we check for the patient's compliance? We usually use an unwaxed dental floss to check the contacts between the teeth. This will give us an idea of the patient's compliance. If the patient is compliant, then the contact will be tight and good. If there is no contact, then probably the patient is not complying very well, and we need to either enforce the compliance or probably backtrack to previous aligners and make sure that we restart the treatment or backtrack the treatment. Signs of patient's non-compliance are when the patient enters your practice for an appointment and is not wearing the aligner. It's a red flag, because if the patient is not wearing the aligner as per the rule of 22 hours, that means when he's entering your clinic, he's not wearing it, maybe he's not wearing it at home as well. When the patient does not attend its scheduled appointments, of course, these dental appointments are very important for a customized treatment and on-time treatment. So if the patients do not understand or realize the importance of the same, probably it's a red flag if the patient is not wearing the appliance at home. When the spaces created by IPR do not close, ideally we create spaces with IPR, that is interproximal reduction, so that it is closed upon later with the help of the aligners to bring about the desired movement. If the spaces do not close, that means the patient has not been wearing the aligners. When the aligner still sits tight after a few weeks, so another purpose of the aligner is to create space as well. So as the patient is wearing the aligner, it should be able to create space for the next aligners to come. And if the same aligner is tight for a long period of time, that means the patient has not been wearing it. When the aligner looks too clean for a few weeks of usage, if you're wearing something in your mouth and if you eat or drink, of course, while eating and drinking, you have to take your aligners out. But even then, for a day-to-day practice, it will stain. If it is perfectly clean, it's very clean, squeaky clean, then probably the patient is not wearing it. When the fit of the aligner worsens over a period of time, this is like the patient is not wearing, or maybe wearing as per their whims and fantasies. So it's very important to make sure that we follow up on such patients very strictly. Next is another way of making the checklist and making sure that the patient is compliant and as well as everything is going as per the treatment plan is checking the oral hygiene. Because if the oral hygiene is good enough, it will prevent the tooth decay, the gum diseases, the white spot lesions, which are very common with different kind of orthodontic treatment. Not with aligners so much, but yes, with the other or conventional orthodontic treatment, we see a lot of white spot lesions. So we do tell the patient to rinse their teeth after eating and drinking, at least brush the teeth 3 times a day, and if possible, use auxiliaries like floss and then your uniflosses and all that. Next one on the checklist is to check the tooth tracking and the fitting of the aligner. So it is very important to compare the actual clinical tooth position with those in the treatment simulation. So when we submit a case for clear aligner solution with TrioClear, you will be receiving a design, which is on the iDesign platform, and you will receive a clinical simulation. So at each stage, you can compare it whether it is actually the clinical situation in the mouth is matching with that of the clinical simulation. If an aligner shows incisal gaps after 2 weeks of wearing, it means that there is either a tracking or compliance issue. If the incisal gap is about 1 mm, it is just the pre-programmed tooth movement. So if the fit is not good enough and you can see a gap between the aligner and the incisal edge of the anteriors, then probably it's not going as per the tracking. So if it is 1 mm, then probably it's not that much. It's just the treatment protocol which we are following, and over a period of time, it will be rectified. If the teeth are tracking, you can continue the treatment as planned. So it's very important to check whether the fit of the aligner is good. So here in this picture, you can definitely see that there is a gap between the teeth as well as the aligner. So here we can determine that the aligner is fitting very well on the lowers, but not so much on the upper. Another thing that we need to check during the same time is the interproximal contacts. When you feel resistance, this means that the contact is too tight. This can be addressed with a minimal amount of additional IPR. So while using the dental floss, it should have a resistance, but not too much that when you're taking it out, it breaks every time. That means it's not creating enough space as required, and maybe you have to go for another IPR, which is very minimal, like just 0.1 mm, but still we have to go another session of IPR. And check the discrepancy between the tooth size and the size of the space you want the tooth to move into. Now, another thing is that we have planned a treatment plan, of course, but clinically also we have to analyze that where we are moving the teeth, is there enough space for its movement? If it is not, then it will cause the same problem. Again, it will be too tight interproximal contacts. If the space is not big enough, the tooth will not move adequately into this area. And in that situation, we will have to either prescribe for IPR or for expansion. Check the attachments. Of course, it is important because if your treatment plan for your patient includes attachment, that's also a very good indicator to check whether the aligners are fitting well or not. Attachments are a little protruded out of your teeth, so it is easier to spot if they're not fitting very well. So another thing is that you have to make sure that you check and count the number of attachments and make sure that as per your stage, you have the same number of attachments in the patient's mouth. Sometimes what happens if the composite is not good enough, or if while you placing the attachment, the protocol was not followed properly, chances of wear of the attachment is very common. And in such situations, there might be, it is not fitting very well, or it is too tight, or it is too low. So it is a good indicator to make sure that the aligner is fitting well or not. Another thing is check the condition. Of course, make sure that the attachments are not, weathered or worn down, or if they're broken or something. And of course, check the fit of the aligner. You can see in these pictures, in the first one, you can see that there is a gap between the incisal edge of the teeth as well as the aligners. And very importantly, there is a gap between the attachment and the socket for the attachment in the aligner. So from here, we can easily make out that it's not fitting very well. And the other one, you can see that the attachments will go and sit like a socket, properly into the place, and it will be fitting perfectly. So another it's a very important step. So it's good to see that what are the different ways of making out the attachments are not seating properly, or maybe the aligners are not sitting very properly on the attachments. Just to make sure that when you're inserting into the correct path of insertion, as well as just making sure that the attachments are sitting very well on the patient's attachment on the tooth. So basically, what actions do we need to take or make sure that we follow during the appointment is, first of all, if the patient has any kind of complaint. So when the patient enters your appointment, you make sure that you have a checklist prepared to ask the patients if they're facing any issues. Usually the most common one is whether they're fitting well or not, which we have already dealt with. They're having some issues with the wearing and removal. We have dealt with that, and compliance also we have done. One more thing that might come on and off is that the patient is saying that it's impinging on the particular tissue and they're not very comfortable wearing the aligner. So what we can suggest them, of course, there are multiple options of solving this issue, but the most commonly and easiest way of doing is asking the patient to use a nail file to trim it down, or you can do it in your own chairside practice. Or there is another way that you can order a new set of aligners which are scalloped and hence more rounded and would not be causing that much of an effect on the soft tissues. Having said that, we increase the gingival coverage in our aligners because that gives us more surface area to cover to bring about a movement. And it gives a more controlled movement. If you reduce it to just a scalloped up to the gum, it might not bring about the same solution, but there are ways to work it out. So yeah. Another thing is, if the patient has lost or damaged an aligner, it's very important to be transparent with your patient. Patient shouldn't be scared to tell you that, okay, probably I have lost one or previous of some of my aligners. They should be able to tell you all of that. Or if they have damage because of any reason, then we have to ask the patient from the start of the treatment, very importantly, to keep all their aligners. I mean, this is a protocol which I think most of the aligner companies follow, and we have to highlight this again. But sometimes the patient might not take a note of it. So it's good to have something given to the patient where it is written to save your aligners till your treatment is completed. Because many a times you have to backtrack, you have to use the previous aligners, and in such situations it would be useful if they have all the aligners properly kept. You can advise the patient to try in the next aligner step and see if it fits. If not, they must return to wearing their previous aligner, and you will have to order a replacement aligner through the TrioClear online platform. So in a particular appointment, another thing that we have to do is IPR and attachments. How do we know whether we do IPR or we place attachments? So with each and every case, you'll be provided with a clinical card as well as with a clinical simulation in the iDesign. And from there, you can make out that, okay, in this particular stage, I have to do the IPR on this particular tooth, and the amount of IPR would be this much. And in the same clinical card, it would also be indicated where to place attachments, in which step, and how to place the attachment. You will be usually given an attachment template for that particular step, so it would be easier for you. As you can see in this particular picture, it is already indicated in the clinical chart that in which step and which teeth and how much of IPR the doctor has to do, and where is it necessary to do the attachment placements and all. So it's much more easier, it's much more easily visible for the doctors as well. In this picture, we can see that it's a clinical reference card. I would say it is one of the most important things for TrioClear and for any doctor who's doing a clear aligner solution treatment, because this gives insight of the whole treatment in just one card. When to do what and how much to do. Everything is indicated. Which tooth has been focused more? What is the problem? How many steps of aligners is required? Whether it is for upper or lower, if there are any missing teeth, or if something which needs to be taken care of. Everything is mentioned in this card. I usually suggest the doctors to keep it very carefully in their clinical practice, attached with each patient's file, so that every time the patient comes back, they can still, check it with the clinical card. Now, let's see a video about placing the attachments, and I will explain with the video. So it's important. Now we know that placing attachment is a part of TrioClear aligner treatment, and how do we place it to enhance the treatment faster? So you will be receiving a template, as you can see on the screen right now. First of all, you have to check the fit of the template. Very, very important. You cannot do anything unless you check the fit of the template. So it's better to check the fit of the template, and after that, you can see that it's a norm. Even for any dental treatment, you have to do the cleaning and polishing before you start the treatment, even for a crown preparation. So same with the clear aligner. Do the cleaning and polishing before you start with the attachment placement. So of that particular tooth, but I would suggest to do for the whole mouth. So after you have checked the attachment template, did the cleaning and polishing, check again after the cleaning and polishing, and then you do the etching of the particular tooth surface. It's a normal composite protocol, so which you do for your other fillings, so nothing much technical here. The same protocol needs to be followed. Same amount of time, same temperature, same curing light, everything same. And after that, we are just using the bonding agent to apply on the tooth surface. And then, of course, we dry it, which is very important. Another thing, and we are light curing it, of course. Another thing which I have not mentioned, but it's by default, make sure that there's saliva and all contamination is avoided during the process for it to last long. And then we do the light curing. And finally, we fill the notches on the attachment templates with the composite. And we just place it nicely and very to avoid any bubbles. And then we place the attachment templates onto the tooth surface and push it with the help of tongs, so that you can make sure that it is seated very properly and tightly into that particular area itself and doesn't overflow. That's just a way of trying to avoid the overflowing of the composite. And then you cure it and you take the attachment template out. It is already set onto the tooth surface. Just check for extra composite onto the outline of the surface and just fit the attachment template once again to double check. Take it out and fit the liner, and you're good to go. Okay, so next step is, now we know what is attachment template and how do we place the attachments on the patient's mouth. How do we do IPR, which is also an equally important part of the TrioClear aligner system. We should do IPR only on the stages as indicated in the TrioClear eye design. It would be mentioned on the eye design as well as on the clinical card. Just follow that. If not possible in the same week, it is advised to perform it at least a week before on the week you're supposed to do the IPR. So say, for example, if it is mentioned in this particular slide that, before wearing the aligner number 7, please perform IPR on the teeth 22 to 21, and the amount of IPR would be 0.5 mm. So make sure that at least on that particular week or the week before you have done the IPR. Don't keep it for the later part of the treatment, because you need to do the IPR to bring about the changes, and then only the changes will come. Otherwise, it will not be as good as we imagine. Okay, so this is a IPR system, IPR intensive swinger, and it's a mechanical way of doing the IPR when you have a lot of teeth to do the IPR, interproximal reduction on, and with doing it with manual gadgets might be a little time taking and tedious also for the doctor as well as the patient to keeping the mouth open for so long. So mechanical trimming is also another way of going about it. So this is a very famous brand and it is quite popular in Europe. If you are interested in procuring the same, we can find out about it and we can also give the contact of the seller. So it's a very simple procedure. I think we have done IPRs for other dental practices as well. So you just do the trimming and you check with your gauge whether it is fitting well, how much more of IPR you need to do, and you just continue doing that. Of course, you have to be careful to be very precise with the instrument. Make sure that you have protected the tongue and the soft tissue, and the motion is as per the indication on the supplier's manual, and not just be very careful with it. But it's a very simple instrument to use, and yeah, it would be easier for you to finish. Of course, having said that, I have to highlight that after IPR, make sure that you have applied fluorides or some sort of remineralization agent so that it's not sensitive later for the patient. Okay, now the final consultations that we need to do for the patient is usually during the last 3 steps. We need to check if there is a need of planned revision by checking if there are any black triangles, tipped roots, premature occlusal contacts, posterior open bite, residual spacing, incomplete rotation, irregular or uneven incisal edges and marginal ridges, and occlusion not fully interdigitated or idealized. Any of these situations might lead to higher chances of relapse. And if there is relapse, then the solution might not last for as long as the patient or the doctor would want. So at the final 3-step appointments, make sure that if we check for all of this, if required, ask for a retracking, or after the treatment, maybe for a refinement for the plan. So let's now deal with all the possible problems with aligners. Now there might be hundreds of them, but at least we can categorize it to 9 major ones. The first one being open bite, very commonly found. All the doctors have, somewhere or the other in some of the patients might have seen that, there is open bite after the treatment is completion. And the patient probably is also more curious about open bites. So there are multiple factors for open bites, but let's deal with one by one. So residual posterior open bite, it's often seen after the alignment treatment. Now here, it is very important to understand the reason for an open bite and how can we resolve it, how to avoid it at the first place. And of course, let's see how we can summarize the whole situation. So reasons for an open bite can be multiple, but the first one is the thickness of the aligner. This is the most common one, not with any particular brand of aligners, but almost with all of them. It's because of the thickness of the aligner. When you're wearing it, it creates a gap between the posterior teeth, and you can see that there is an open bite, but over a period of time, it automatically closes when you're using the retainers correctly. But having said that, of course, it is there. So it was caused because of the transient intrusion of the posterior teeth due to the aligner material onto the occlusal surface, which is a way of bringing about the movement. And the second reason is the premature anterior contact. So for example, due to the presence of a proclination in the lower arch compared to that in the upper arch. So usually we have upper arch and lower arch with a gap of 2 to 3 mm between them, the horizontal overjet. But what happens is if your lower arch is in front or maybe almost edge to edge to the upper arch, then there is premature contact every time the patient is closing or opening the mouth. So that would cause chances of open bite in the posterior region. Or due to the insufficient leveling of the curve of space. So when we are planning a treatment plan, Of course, we have to keep in mind about the curve of speed, and that is how our designers design the treatment plan. But because of the wearing of many a times, the clinical situation might not be the same as that of the designed initially. So there might be a chances of not leveling of the curve of speed properly, and that could lead a gap in the posterior region. Another thing is, if the open bite is small, which is less than 1 mm, it's very easy to handle. We can section the aligner distal to the canines to allow just the posteriors to supra-erupt or just to erupt. The patient must wear these aligners for a week or maybe 2 to 3 weeks and should be monitored every 3 weeks. By 3 weeks, we should be able to see the changes and we can make out whether the open bite is actually getting closed. If it is getting closed, we can continue with the same. If not, then probably we have to ask for a refinement or something. Before you section the aligners, just make sure that how big is the open bite, if it is tangible, because if it is only on the posterior surface, maybe it is easier to handle. But if you see that maybe the open bite is also extended a little bit more towards the anterior, it's better to go for a refinement rather than to, cut the aligners and go about it. Of course, we have to take note of the premature anterior contact, which I just mentioned, if it is actually happening. Having discussed about this, every designer team always makes sure while designing that there is no premature anterior contact at the end of the treatment. But clinical situations vary and we all know about it. So if there are premature anterior contact, we have to make sure of taking note of that as well. And also if there are any supra-erupted tooth in the occlusion, just have to take note of all of these. How to avoid the open bite? Check in simulation for more procrelation in the upper jaw than in lower jaw. So we have to make sure just now for situations where we might have premature anterior contact that the upper jaw is a little bit more proclinated than the lower jaw during the treatment plan. We need to avoid tight overjet in the setup. And we should at least have 1 to 5 mm of overjet when submitting the case. When submitting the case means when you're submitting the case, you have a questionnaire which you have been filling on this file. There, at least you have to write that I need 1 to 5 mm of overjet at the end of the treatment, because that will give you sufficient space between the anterior and upper and lower jaw to avoid premature contact during the treatment or at the end of the treatment. Do not overexpand and also ask for bite ramps. Bite ramps are actually a very good solution if there are posterior open bites. You can see in this picture, it can be included in the aligners. Some doctors also do it separately from the aligners, but ideally you can include in the aligners as well. There are a few possible causes for aligner fitting issues. Poor fitting can be on the very first step, maybe because of 2 reasons. The first one being an inaccurate 3D model. So when you're scanning, there are chances that you might not be able to cover the gingiva to the portions that we need, or the interproximal areas are sometimes very difficult to capture, especially the distal portion of your last molar teeth. Though we don't need it, but if the 7s are your last molar teeth, then probably it's a little difficult to capture that. Also, the mouth opening of the patient also affects while taking the scans. Also, the second reasons for the aligners to not fit in the very first appointment is if the attachments are not engaging. So we have placed attachments, and ideally the attachment should be able to engage the aligners when stuck in properly. But if they're not engaging properly, maybe because of how you have placed it, or maybe the template issues, or we didn't check the fit of the template before we place the attachment, that could lead to the attachments not being engaging enough. Teeth aren't tracking due to the lack of space or insufficient pressure. It could be because of the non-compliance of the patient. It could be because there is not enough space due to inadequate IPR. Position of the teeth can affect the alignment path of insertion or removal, and lack of extrusion or undesired intrusion of a tooth. So what to do in such situations? We can ask the patient to wear the aligners and put chewy in between the upper and the lower jaws and chew them for like 10-15 minutes. Make sure that the aligner seats properly. And once the aligner seats properly, the patient can stop chewing. But these chewies that are provided with the samples or with the case is good enough for the patient to insert between the 2 aligners and chew, and to make sure that it fits properly. So in this case example, if you can see, you can see that there is a gap between the incisal edges and the aligners. And also you can see that there is an attachment on the lateral, I think 1-2, and it's not seating very well. So what we did is we took out the attachments and we redid the attachments with the help of a window. and then we try to insert the previous aligner with the help of the new attachments on the new attachment, and it fitted perfectly well. So the problem was solved. Possible problems again with aligners is bisphosphonate. It's not really a problem. It's just a medication if the patient has been taking for some other reasons or some other medical conditions, and this basically leads to osteonecrosis of the jaw. And certain parts of orthodontic treatment plan, for example, the extraction of teeth, could be a very high risk if the patient is taking bisphosphonate. In addition to the desired effects on the bone metabolism, bisphosphonate can slow or block the orthodontic movement of the dental elements. So not only for the clear aligners, even for a normal orthodontic treatment, even for sometimes for implant cases, we usually defer the patient to go under any kind of treatment unless they have stopped their bisphosphonate. So yeah, it is better to defer it till the time they finish the bisphosphonate treatment. Unwanted intrusions are another problem with the aligners. So the cause is basically lack of space. So when you're trying to bring about a movement and you do not have enough space, instead of bringing the teeth outside or expanding, sometimes it leads to intrusion of teeth, and that could be force plus space plus movement. And how to avoid it is that the mesial and distal contact should be checked with dental floss at every dental checkup. So it is important to make sure that we insert a dental floss between the teeth, mesial and distal contact, so that we can make out that there's sufficient space for the teeth to go to its next step, next place in the movement. If there is not enough, then definitely we need to do the IPR and increase the distance between the teeth. As you can see in this particular picture, teeth cannot collide together to create space, right? So we have to create space for it, either by expanding or by IPR. So if there is not sufficient space, the teeth will unfortunately intrude, and then it will become difficult for you to handle the situation. So always follow the IPR protocol, follow the attachment protocol, follow the expansion protocol. But if in case certain places we have discussed earlier as well, you might have to increase the IPR by 0.1 as the situation arises. The next one is insufficient pressure. So pressure is a very subjective thing. It's, of course, it can be measured in newtons per centimeter square. But having said that, it is very subjective. Some movements like intrusions, extrusions, and rotations require more pressure. Some types of teeth like maxillary laterals, premolars, and molars would require more pressure. And other factors like short clinical crowns, age, and health of the teeth present also determine the amount of pressure required to bring about the same movement into different particular patients, right? So it's important to determine the amount of correct pressure which is required for that patient. That is why it is important to take the history properly for the patient, the health conditions, any medications that they are on, so that when they're designing the treatment plan, they're all taken into consideration. The next one is the incomplete root movements. Incomplete root movements are quite common with all kinds of aligners or even orthodontic, conventional orthodontic processes, because these are clinical situations which might not be completely under the clinician's hand. But there are solutions to take care of this. You can use buttons and elastic techniques, combination with fixed appliances, and also TADs, that's temporary anchorage devices. So TADs are basically safe, they're temporary. You can also use micro screws, make difficult movements easier, and they reduce the treatment plans, of course. And the time required for the treatment plan can be used with braces or clear aligners. So it increases the range of movements possible with such solutions, and it also decreases the time required for the aligner treatment. So all in all, a win-win situation. Of course, if the patient has a history of tooth trauma, again, to highlight this, that history taking is very important. So if the patient has had any kind of tooth trauma or a fall, and sometimes they forget, but we need to ask them and bring about. If they had any ankylosis, of course, we have to do percussion test before we start any treatment, which is a usual protocol. But yes, again, make sure that we have taken the history of any trauma for the patient. Bone type. Of course, different types of bone react differently to different types of pressure and bring about different movements. And mandibular bone is comparatively denser when you see it with maxillary bone. So it requires a longer period of time to bring about a certain movement as would require by a maxillary bone. Staining or discoloration of aligners. Oh, this usually happens with all the appliances that patients put in their mouth. So if they're drinking tea, coffee, staining agents, turmeric, they will definitely have the staining on the aligners. So, or the patient is not very careful with its hygiene. So this is a red flag. If they're not very careful with the hygiene, probably we have to educate them, because an aligner needs to be worn at least for 7 days. And for those 7 days, it has to be cleaned properly so that it doesn't lead to any other perio problem in the patient's mouth. Okay, now coming to the most interesting part, troubleshooting techniques. Something gone wrong has happened. How do I handle it? How do I take care of the situation? So there might be a lot of situations where, you have to find a solution, but we have categorized it into 8, and then we can discuss about that. So default auxiliaries for troubleshooting. We have attachments, we have dimples on the aligners, and we also have elastics. So basically elastics attached to the teeth with buttons in cutouts, elastic attached to the aligner with precision cuts, and elastics attached to the pressed buttons on the aligners. We can use class 2 or class 3 elastics, cross-bite elastics, posterior vertical elastics, and rotational elastics. Also, there is one more type available, which is intrusion-extrusion elastics. Techniques for extrusion issues is like we can use elastics and dimples. Now, this is just a symbolic picture. It is just to show that all types of conventional orthodontic movement which are possible with elastics are also possible with TrioClear solution. Because we can insert buttons, we can insert elastics, and we can also have dimples, which can bring about the same kind of movement. So techniques for rotation issues is with elastics and with triodim force. You can see in this particular picture that the canine is rotated. We would like to bring it into the occlusion, and we can apply elastics on either side of the canine, as well as to the anterior and a little bit on the posterior teeth, depending upon the design team, of course. I mean, we don't design it. The designing team, after analyzing the situation and the x-rays and everything, will design the elastics and the placement of the elastics in the patient's mouth. And if we follow that, we'll be able to bring it about into the correct occlusion for the patient. Technique for intrusion issues, how to handle them. With elastics, we can use tads on buccal and palatal side, and we can either try to bring the whole plate into alignment to bring about an intrusion, or we can particularly insert it for an element and just make intrusion happen for that particular element. With elastics, also on the buccal side, what we can do is we can attach it for the posteriors and bring about intrusion so that for anterior open bite it is reduced. Backtracking. So backtracking means switching to a previous aligner set that fits. The patient, again, having said previously as well, should preserve and keep properly all of their previous aligners till the treatment is completed. So sometimes what happens is if your aligners are not fitting very well, or if you have lost one or the other, you usually need to go back to your previous set of aligners which fit well. And then you track again to your treatment plan. So that is indications for backtracking are incisal gap, aligners not seating as I mentioned, aligners gradually worsening on the fit, again the same thing, incomplete tooth movement. So sometimes what we desired for a particular step has not happened, maybe because of any cause, maybe because of the periodontal condition of the patient, maybe because of the compliance, maybe because of the design. So for that also we can go to a previous fitting aligner and then track again onto the treatment plan. If the patient has been non-compliant, of course, one of the most common reasons. Overcorrection. This is a very general, commonly used term for orthodontic treatments. All the orthodontics, if I know correctly, use overcorrection even in their treatment, because it just brings about a sort of, peace of mind that even after a certain amount of relapse, it will still be the way that we want the treatment to end at. So basically what it is adjusting specific teeth into a position just beyond perfect alignment for deficit in tooth movement. So some teeth are more likely to relapse after orthodontic aligner treatment. Of course, when you're wearing aligners and retainers following the protocol correctly, you will have less of the chances, but there are chances of it to happen. So it is not always the designing team who are providing this. Sometimes the dentist asks that I want a little bit of overcorrection for this particular element, or for this particular arch, or for this particular quadrant. And then we bring about the movement accordingly. And then relapse sensitive movements is like rotations, which are very prone to relapse, expansion, extrusion. Extrusion because, You have stretched the PDL ligament, and if the bone has not formed during that period of time, the PDL ligament has tendency to pull the teeth back or tooth back, and that could cause relapse. Refinements is another troubleshooting technique. So if you see that there are black triangles, tipped root, premature occlusal contacts, posterior open bite, residual crowding, incomplete rotation, irregular, uneven incisal edges and marginal ridges, occlusion not fully interdigitated or idealized, and you're not able to backtrack the situation, then probably you should go for refinement, because that is the last resort for any kind of troubleshooting related to clear aligners. So always try wearing the aligners for longer, backtracking in auxiliaries before asking for refinement, and ask the patient to always bring all his aligners to every visit again. But having said this, when you are asking for refinement, please make sure to indicate the reason for refinement. What are the causes that raised this issue, and which areas would you like the design team to address? Because if you're not very specific, they might go into a different direction, or if whatever is the patient's requirement as well, it's very important. So if we are aware of all of that, probably we can come up with a better solution for the patient. Finally, let's talk about retention. Or no orthodontic treatment is complete without a retention plan. So what is retention? What is the strategy, and how do we do it, and what is the protocol? So to allow for the soft and hard tissue to reorganize, we usually need 7 months approximately, about that, post-tooth movement. So the teeth may be in inherently unstable position after the treatment, so that the soft tissue's pressure constantly reduce relapse tendency. Growth, aging, and other physical properties also play a very important role. We all know that if we do not have, even if we don't have any treatment done in our mouth, and if we have space between 2 teeth because of extraction, the space usually closes because, there is always movement happening in the mouth. So to prevent from that to happen, we use retainers. Retention of after a treatment plan in orthodontia has to be discussed with the patient on the very first day, on the consultation itself, because sometimes patients are not aware that they have to wear the retainers for a substantial period of time after the treatment is over. So we have to highlight it to them that after the treatment is over, they still have to wear the retainers for a certain period of time. At every monitoring consultation, again, have to emphasize again. And at the post-treatment consultation, when you're giving it to the patient, the retainers have to indicate again to them. What to discuss about retention is why retention is required. Of course, as I explained, we need to explain the same thing, probably a little bit more layman terms to the patient, that why it is important and why they cannot be non-compliant with it. That you have a good solution for retention. We provide Acodont with TrioClear aligners, so you can ask for it and you can give to the patient. Of course, the quality is very good. The retention is very good, and it is a complementary pack with TrioClear. And it is an agreement between you and the patient, so it has to be properly documented. Different types of retention options are possible. Either you can use Acodont, which is along with TrioClear, or you can also use fixed retainers, depending upon the clinical situation of the patient as well. But there is also one more possibility. Nowadays, we can have the fixed retainers fixed into the aligner or the retainer, so that it is easier for the patient to wear, and rather than for the doctor to fix it on the patient's mouth. There's a retention protocol that we need to follow. Immediately after ending the retainer, the treatment, we need to have a full time period equivalent to the length of the treatment. So say, for example, if you wore the aligners, irrespective of the number of steps, for like 3 months, your retention also has to be for 3 months, full time. After this, 4 hours every day and during sleep for at least a year. And then during sleep only, and after 2 years, twice a week during sleep only. So it's a protocol. It can be varied according to the clinical condition and the doctor's and the patient's preference, but retainers need to be worn. Fixed retainers, monitor and clear professionally 3 times per year during 10 years time. So fixed, patients usually do not do much about it. There's no compliance issue there. You can just fix it one and just be relaxed that it will be there. But having said that, patients usually prefer to have removables because they're not visible and they're more aesthetic. So with that, I would like to end the session. I think I have been able to address most of your concerns, but if you still have any further queries or any other thing to discuss, please feel free to contact us. Have a great day ahead, and thank you for joining.